All right. Well, hi, everyone, and welcome to Pharmacology for Veterinary Technicians. We're going to be talking about drugs that affect the respiratory system today. And we're using a program called Zoom, which has a lot of great features and some kind of weird features. So, one weird feature is that I am going to be having to switch back and forth on some of the screens. And you'll see it's not too bad. Um, but you'll just have to look at my dumb fat face while I look puzzled. And we're going to watch some videos. And with Zoom, the audio is pretty good, but there's a little bit of lag with the visual part. I think it's okay, but I'll have the original PowerPoint posted, and you can always watch the video there. And in fact, you may just want to look at the PowerPoint. But if you'd like to hear my voice, you can use this, and I'll try to fill in a few things, but to try to explain some of what we have here. There are also subtitles, and I'm going to speak slowly and deliberately, which may put you to sleep, but it will allow the subtitles, I hope, to be pretty clear. One last thing is this is all recorded without editing. So if I goof up, we're all stuck with it. I can't just snip it out. So if I pick my nose, then we're stuck with it. I'll try not to pick my nose. But let's begin talking about, and I don't even know where I'm supposed to look. I don't, I think there's my little camera. So to begin, um, let's do a couple things here. I'm not sure what you can see, but we'll start here. Okay, so we're going to talk about a few different things today, and I'll explain what this crazy looking device is. But our plan is going to be first, we want to talk about, let me turn on the subtitles here. Hold on. So our plan is we're going to review some of the structures of the respiratory system, find out why is oxygen important, how does this system, this respiratory system, deliver oxygen to your cells? How does it get rid of carbon dioxide? What are some of the ways the respiratory system protects itself? And how can disease alter that? We'll learn about some of the different therapies, including antitussives. So, what are they? How do they work? How do these things called mucolytics and expectorants and decongestants work? How do bronchodilators work? How are corticosteroids and antihistamines useful in respiratory disease? And how do they differ from each other? How is prednisone different from Benadryl, for example? And how are other therapies used? Therapies like diuretics, like furosemide, um, antibiotics, and oxygen. How are they used in the treatment of respiratory disease? We'll begin with, let's travel down this horse's nose and kind of get an overview of the respiratory system. We're traveling now through the nose, and now we're going into the pharynx, and now what you're seeing is the larynx. That's what this is right here. There's the horse's larynx. Um, um, that's kind of your Adam's apple. If you can feel that, that's your own larynx. It's this complicated little structure, and one of its jobs is to control, help prevent food and water from traveling down your trachea. So again, we have the nasal cavity. We've got the pharynx here. It's called the oropharynx. The pharynx is really more of a space, It's in the back of the mouth. It's where the oral cavity splits into the esophagus and the trachea. And then, as I mentioned, you have this structure called the larynx, which helps control where food and water go to make sure they travel down the esophagus and not into your lungs. After that, we have the actual trachea. So there's the trachea itself. You can feel your own trachea. So why don't you do that right now? You can feel these ridges. There's actual rings of cartilage, very rigid structures that help keep this airway open. It travels all the way down into your thorax, where it splits into bronchus. There's a right bronchus and a left bronchus. The plural is bronchi or bronchi, and then the bronchi can split into smaller bronchi and smaller bronchi. Eventually, they split into very small airways called bronchioles. You can think of them as being like the arterioles in the blood system, but these are bronchioles, and then they end in these little clusters of air sacs called alveoli. And you can just think of these alveoli as being like a cluster of grapes, but in each grape is a little air sac. It is super thin, a very delicate, thin-walled structure, and that's where oxygen and carbon dioxide can pass into the capillaries. But you'll see that more later. When we talk about diseases of the respiratory system, they can be anywhere along from the nasal passages to the larynx, to the trachea, to the bronchi, all the way down to the alveoli. The most serious problems result in the inability for oxygen to reach the cells. Not all respiratory problems are going to cause that, but the most serious, like pneumonia, that's what can kill your patient. And in particular, this is just showing you the whole structure, right? There's the lungs, there's the diaphragm, there's the trachea. There's two organs in particular that are really vulnerable to damage if they don't get oxygen. And that, of course, would be your heart and brain. A lack of oxygen, reduced oxygen levels can harm any organ, but those two in particular, the heart and brain, are the most vulnerable. They have very high demands for oxygen. And so we need to do whatever we can for them to get oxygen. So as you watch this video, this provides sort of an overview of what we've just talked about, and talks about what happens once air reaches your alveoli. So as you watch, take a deep breath. Imagine that air flowing down to your alveoli as you watch this.
Gas exchange. All of our cells need energy. They get it by breaking down glucose, a simple sugar we get from food. This process, called cellular respiration, uses oxygen and produces carbon dioxide as waste. The main function of the respiratory system is to provide the oxygen from out of the air and remove the carbon dioxide into the air. This takes place in the lungs, with the gases carried to and from the cells by the bloodstream. The exchange of gases between the blood and the air occurs in the alveoli, microscopic air sacs in the lungs that are surrounded by tiny blood vessels. When we inhale, all 300 million alveoli expand and fill with air. Oxygen diffuses from the alveoli into the blood, and carbon dioxide diffuses from the blood into the alveoli. Diffusion is the natural movement of gas or liquid particles from an area of higher concentration to an area of lower concentration. Think of how the smell of baking biscuits spreads out from the oven right through the house. Diffusion can even take place through a membrane if the particles are small enough to get through it. For example, a helium balloon that's been left for a couple of days gets smaller and softer because the helium has slowly diffused through the skin of the balloon into the surrounding air. The walls of the alveoli are membranes too, ones that oxygen and carbon dioxide can diffuse through. Because breathing keeps bringing fresh air into the lungs and the circulatory system keeps bringing blood that is low in oxygen and high in carbon dioxide, diffusion always acts to bring oxygen into the body and take carbon dioxide out. And this goes on day in, day out, for every minute of our lives, so that our cells stay alive and so that we stay alive.
Yeah. All right. Bear with me. New share. You're still recording. Let's make sure we're still recording here. Right. Good. We are still recording. Yep. Okay. Now let's talk about some of the protective mechanisms your respiratory system uses. You want oxygen to get in, but you don't want smoke or excessive dust or coronavirus or bacteria or a fungus, right? You don't want that to get in. So how do we get the oxygen in without all the bad stuff? And that's what we'll talk about next. So certainly in your nasal passages, sneezing is one way to get certain bad things out. And of course, you make boogers, right? You make mucus in your nose and things get trapped. I misspelled mucus. I misspelled it. It should be spelled M-U-C-U-S. In your larynx, in your trachea, you have what's called coughing. And coughing is really pretty interesting. There are special sensory neurons in your larynx, your trachea, the bronchi, and the bronchioles. And when they're irritated, they send impulses to a part of the brain called the brain stem. So this horse here is coughing, and some part of his airway is irritated. The brain stem controls many unconscious involuntary actions. You have part of the brain stem called the hypothalamus that helps control your body temperature. There's another part called the medulla oblongata that controls respiratory rate and respiratory depth. Again, you can see here's the brain stem here, and there's this one little part called the medulla oblongata. Well, this respiratory center is right next to the cough center. And when the cough center receives sensory input from an irritated larynx or trachea or whatever, you cough. And the nature of the cough is determined by the location of the cough receptors. In other words, well, what part is being irritated? Where is the problem? Is it the larynx, the trachea, the bronchi, the bronchioles? It will affect the cough. It can also affect how the patient breathes, but that's for another time. We can, so I mentioned it can affect the nature of the cough. So let's talk about that. because we can learn a lot about what's wrong just by listening to the cough. Coughs can be classified as non-productive or productive. A non-productive cough, you would call it a dry and hacking cough. Very harsh. There's not much mucus being produced. We see this with inflammation. I should say inflammation of the upper airway. I shouldn't say upper, but maybe of the larynx or the trachea. We also see non-productive coughs in some early stages of infection. It's not mentioned in the book, but non-productive coughs often are associated with inflammation of the larynx and the trachea, so right here, and sometimes of the bronchi. In other words, we see it with kennel cough. If you've worked around dogs very much, you've probably heard of kennel cough. It's a very contagious group of viruses and bacteria that cause this very characteristic dry hacking cough. The medical term for kennel cough is infectious tracheobronchitis, again referring to inflammation of the trachea and the bronchi. Another condition that will cause a non-productive cough would be collapsing trachea, and I'll show you more of that in a moment. There's also bronchitis. Sometimes bronchitis can become productive, um, but maybe in mild cases we could say it would be non-productive. This cat, for example, has bronchitis, and you're going to hear a non-productive cough. Specifically, this cat has allergic bronchitis. So something, pollen or something in the air is causing inflammation of his bronchi. And you'll hear this, we call it asthma, but you'll hear this very harsh, dry, hacking kind of cough.
Go ahead, Sonny. You're okay.
There you go. Ooh. Right, very, very harsh and dry. Now, you can also have what's called a productive cough, and this you would describe it maybe as a wet cough. It produces mucus. Um, I also think of it as there can be, other fluid, or I'll call it crud. But by crud, I mean, um, purulent material, neutrophils, and basically like pus. It's not mentioned in the book, but productive coughs often are associated with infection in the bronchi, bronchioles, or the alveoli, or with pulmonary edema. What could cause infection in the alveoli? Well, that's what we would call pneumonia. And pulmonary edema, that can be caused by different things, but the most common thing would be congestive heart failure, causing fluid. It's not infection, it's just fluid that the heart, it's building up because the heart can't pump very well. I can't find a great example of a productive cough in animals. Again, just to show you, this would be a productive cough we might associate with some sort of problem down here in the bronchioles or the alveoli. So we're going to listen to some coughs in people. It's not quite how it would sound in an animal, but it's similar. So you'll hear a little bit of a non-productive cough, I think, but mostly we're going to listen to a productive cough. So bear with me.
One of the best ways to diagnose a cough, and the way we do it, is by listening. So let's listen to this cough.
Okay, so let me zoom forward here. So this is part of a dry cough.
Getting back to asthma, dry cough, if you're in an environment where there's a lot of pollutants, you can get irritation, and that's your response is to cough. There's nothing to cough up, as opposed to this type of cough. You're coughing something up here.
Right, you're coughing something up. Hold on. Right, you heard that. He said you're coughing something up. And that's a good way to describe the productive cough. You're producing mucus and crud. Not the productive coffee, the productive cough. And remember, we're talking about some of the ways the respiratory system protects itself. So we mentioned the nasal passages, sneezing, mucus, coughing. Something else that takes place, I think it can take place in the trachea and the bronchi and the bronchioles. It doesn't really matter, but you have these little hairs called cilia. That's what these are. So just millions of these little hairs, and you have this little blanket of mucus. And these two work together in what's called the mucociliary apparatus. And it's really beautiful how this works. It's working all the time. And what happens is if the coronavirus or bacteria or a lot of dust particles, or a fungus, if they try to invade your airway, what happens is they can get trapped in the mucus, and then they're trapped there, and these little hairs are constantly trying to move things up towards your larynx. So things get trapped in this blob of mucus, and then your cilia bring it up here to close to your larynx, where you can then go and spit it out. I'm not very good at that. I won't demonstrate. But again, when you go, well, that's your mucociliary apparatus. And I'll just show you that here, right? There's the mucus. Imagine stuff trapped in it and these little hairs. Here's another view, right? These little hairs moving little blobs of mucus up and out, where you can go, or if you're really gross, you can just swallow it. Okay, where then stomach acid destroys it. Other ways your system will protect itself, you've got in the bronchi, or really I should say the bronchioles, they have smooth muscle and they can narrow. That's important. Let's say it's really smoky. Well, your bronchi and bronchioles can constrict to prevent smoke and other nasty gases from reaching the very delicate alveoli. So again, this is smooth muscle. Those are the alveoli. They're smooth muscle making the bronchial constrict. A little bit is okay, A little bit of bronchoconstriction is okay, but you'll see that sometimes it's excessive. And the final way you protect yourself is you also have this population of white blood cells that they live in the alveoli. They're kind of like the border patrol of your alveoli. So this is a macrophage. That's a very large white blood cell that can engulf and eat bacteria, fungi, viruses. It can eat dust, whatever it needs to, it can eat so that it won't harm you. And in this video, you can see these little bacteria. Oh, he's just gobbling them up like Cheetos, like weird green Cheetos. He's just eating those bacteria. Yum, yum, yum. There they go. All right, so all of these guys are working together to protect you. Well, disease can target some of these systems, and other things can happen too. But first of all, some viruses like the kennel cough virus, it will target the cilia and the mucociliary apparatus. So the viruses will attack, it'll attack these cilia. With no cilia, then your trachea and your bronchioles, they can't really defend themselves as well. And so that can lead the way to a worse infection. And then COVID-19 also attacks, it can attack the upper airway or the lower airway or both. This video is not super specific about what COVID-19 is doing. Wait, is it COVID-19? I don't know, but it's timely, so let's watch this as well.
COVID-19 is a respiratory illness caused by a new type of coronavirus. But what is the respiratory system and how is it affected by COVID-19? We spoke to Professor Debbie Bogart, Scottish Senior Clinical Fellow and Honorary Consultant in Paediatric Infectious Diseases. Our respiratory system is a series of organs responsible for taking in oxygen and expelling carbon dioxide, also known as something called gas exchange. Professor Bogart told us that when we become infected with COVID-19, it can cause an infection in part of this respiratory system, known as the respiratory tree, which is found in our lungs. The respiratory tree, also called the bronchial tree, is a name given to the branch-like structure in our lungs, which includes the bronchi, right down to the tiny air sacs called alveoli. Professor Bogart goes on to say that when we contract COVID-19, the lining of the respiratory tree typically becomes damaged, irritating the nerves in the lining of the airway and causing that dry cough we've heard about. However, for a small number of people, the infection can cause more severe problems by affecting what's known as gas exchange. Gas exchange happens around the alveoli, those tiny air sacs at the tips of the respiratory tree. Oxygen passes into the blood and carbon dioxide passes from the blood into the alveoli and is then exhaled. Professor Bogart says that if COVID-19 affects this process, our body becomes less able to take on oxygen and get rid of that carbon dioxide over time, and some people will need a ventilator to help them breathe.
Now, that's how some viruses or bacteria, that's how they can sometimes target particular parts of the respiratory system, and I'll show you a few more examples later. Sometimes protective mechanisms cause more harm than good. So, for example, this cat has an upper respiratory infection, and so his nasal passages are making mucus. Good. But bad, because if there's too much mucus, it can affect the cat's ability to smell. And if the cat cannot smell, the cat may not want to eat, and that's not good. So that's an example of a mechanism causing more harm than good. Excessive coughing can do several things. I'll tell you more, but one thing excessive coughing can do is cause deterioration of the rings of cartilage and weaken them. And then finally, we mentioned that a little bronchoconstrictive activity is good, but too much can make it very difficult to breathe, causing wheezing. If you've ever known anybody with asthma, you can just imagine trying to breathe through all of these narrow little airways like this. So it's too much bronchoconstriction. And so let me just tell you a few things. So for example, let me tell you a few things about a condition called tracheal collapse. Again, the trachea, here it is. That's the windpipe. It starts up here and then it travels into the chest, and it splits into a right and left bronchi. So this is a normal trachea. It's this rigid tube. This patient has what's called a collapsing trachea, and you can see how it's collapsed here, how narrow it is. This patient, you can imagine trying to breathe and suddenly your trachea collapses on itself. It probably feels like you're choking on something. And what can happen is these patients will start to cough and cough and cough, and they'll irritate the trachea and the larynx, which makes them want to cough more, and they get trapped in this vicious cycle, and all that coughing makes the airway deteriorate. It makes the trachea deteriorate more and more. So here's a little dog with a collapsing trachea, and as you listen, ask yourself, does this sound like a non-productive cough or a productive cough? So what do you think? Well, that would be an example of a non-productive cough. Harsh, dry, he's not coughing anything up. Kennel cough would sound the same way. Some of these patients, they'll cough so much that some white foam comes up. It's not mucus. It's just saliva that looks like a little milkshake. And you'll see a video later where an owner calls his dogs have kennel cough, and the dog coughs up some foam and he calls it mucus, but he shouldn't call it mucus. But anyway, the point with this is all that coughing causes these rings to deteriorate, and it further irritates the trachea. So these poor little guys just cough more and more. Another condition we mentioned was inflammation of the bronchi or the bronchioles, and we call this bronchitis. This can be caused from an infection like kennel cough. It can be caused from allergies. We would call that asthma. You can just see how narrow that airway gets, right? There's a little plug of mucus around it. Imagine all of your bronchioles looking like this bronchiole. Sometimes bronchitis develops and there is no known cause. We call that idiopathic bronchitis. And this video is, I think it's a cat. You're mostly just going to hear the cat coughing. but you can kind of hear this, it's a little bit of a wheeze while he coughs. It's kind of a dry cough, a little bit of a wheeze in there. And then this horse also has asthma. Again, it's an allergic bronchitis. They call this condition recurrent airway obstruction, but it's still asthma. And this horse, just notice how much effort he has to use to breathe. You'll see his nostrils are just huge. And you'll even, if you listen very closely, you'll hear this wheezing sound. And the narrator will tell you about something called a heave line. So listen for that.
Doing. You okay? Steve? TV, but I want to show my students what it looks like. Here. You want to hold it for a second? I want to show the abdomen.
Those are huge nostrils. He's really, really working hard to get that air in.
See the heat line right here.
Oh, so the heave line, hold on, I'm sorry.
They're known as
the heave line, that just refers to those muscles. You know, they're probably abdominal muscles or some muscles along the chest wall that hypertrophy from all this extra work. And so you may see that in a patient. And then the final just condition I wanted to show you was pneumonia. Again, normal lungs should be pink, like a big pink sponge, light and fluffy. And if you were to squeeze them, they would just bounce right back. And again, these are normal. There's a normal bronchiole with normal alveoli. With pneumonia, now those alveoli are filling up with fluid. It could be, you know, mucus. It could be kind of a purulent crud. And what it will do, remember, you've got hundreds of millions of these alveoli. What will happen is whole sections of the lung will feel, if you take your hand and feel right here, that's what they'll feel like, firm and meaty. And that's not how lung that feels that firm cannot exchange oxygen. That part of the lung is just useless now. And you can just, this is a horrible video, but this cow has advanced pneumonia and she just cannot get enough oxygen because whole parts of her lungs are dense and purple like that. So just watch. And if she could cough, if she is coughing, it's probably some sort of a non-productive cough. I mean, look at her. She's got her head out. Her tongue is out. She just looks like she's panicking, and she's her respiratory rate is way higher than normal because she's just trying to get as much oxygen in as she can. Right? That's just horrible. So, yeah. Okay. All right. So this is the end of part 1. There's 3 parts. This is the end of part 1. So let's do a little review here. We learned that one of the functions of the respiratory system is external respiration, the exchange of oxygen for carbon dioxide in the lungs so that internal respiration at the level of your cells and tissues can take place. We learned that the respiratory system has many defense mechanisms: sneezing, coughing, mucus, cilia, bronchoconstriction, and alveolar macrophages. And we learned that under certain circumstances, these protective mechanisms become overstimulated. For example, excessive bronchoconstriction, or they act when they are not needed, such as excessive coughing. That little dog with the collapsing trachea does not need to cough so much. There's nothing to cough out. He's just trapped in a vicious cycle. Same the dog with kennel cough or the dog with bronchitis. They may start coughing so much that they irritate their airways and they cough more than they really need to. So we will call that excessive coughing. So when you're ready, move on to part 2. If you have any questions about what we've done so far, you can email me via Canvas. You could call me at this number. You could post a question in the help folder, and you can answer each other's questions. I have not made that folder yet, but I will. All right, and I'll see you in part 2. And I hope this works.